Let's bust some myths about cardiac PET scans, and then I'll walk you through exactly what to expect. Myth 1. PET is just a fancy X-ray. Nope. PET shows function, how your heart muscle uses blood and oxygen, rather than just structure. It's like switching from a still photo to a live performance of your heart's metabolism and blood flow. Myth 2. The radiation is huge. It's not zero, but modern cardiac PET often uses doses comparable to or lower than many CT scans. It's optimized to answer specific questions, so you don't need multiple tests. Myth 3. It's super claustrophobic. Most PET scanners are open at the sides. Your head is usually outside, and the scan is quiet and short. Myth 4. They inject sugar that can hurt my heart. The tracer is a tiny amount of a glucose-like or flow tracer. It doesn't feed disease. It just lets the camera see how your heart's working. Myth 5. It's only for blocked arteries. Cardiac PET evaluates microvascular disease. Cardiac PET evaluates viability. Is muscle alive? Cardiac PET evaluates inflammation like sarcoidosis. Cardiac PET evaluates infection, sometimes. Okay, quick guide. Who benefits? Chest pain with unclear cause, prior abnormal stress tests, known coronary disease, suspected microvascular angina, weak heart, where we're deciding if muscle can recover, evaluation for cardiac sarcoidosis. Prep. You'll usually fast for 12 hours. Skip caffeine that day, coffee, tea, energy drinks, even decaf. Some meds are paused. Your team will tell you which. If you're diabetic, they'll customize timing around insulin and meals. Hydrate unless told otherwise. What happens? Check in. IV placed. You may get a rest scan and a stress scan. For stress, it's usually a medicine, like regadenoson, that increases blood flow briefly. You'll feel warm, maybe flushed or short of breath for a minute or two. It fades quickly. Tracer time. They inject a small amount of tracer. You wait while it circulates, often 20-60 minutes. Then you lie on the table for images, usually 10-20 minutes per part. Try to stay still and breathe normally. What you feel? No pain from the scanner. The IV pinch is the main discomfort. Side effects from stress meds are typically mild and short. Tell the team if anything feels off. They're watching you the whole time. After, drink water. You can usually eat and go about your day. The tiny radiation amount fades on its own and leaves through urine. What PET tells your doctor, blood flow maps at rest and stress, how evenly your heart is supplied. Absolute flow numbers and coronary flow reserve. This helps detect microvascular issues SPECT can miss. Viability, scarred versus hibernating muscle, which guides decisions about stents or bypass. Inflammation. When looking for sarcoidosis or infection. Accuracy. Cardiac PET is among the most accurate non-invasive tests for blood flow and viability, with lower false positives in larger bodies and faster scans than many alternatives. Alternatives: stress echo, SPECT, coronary CT angiography.